Hi everyone, welcome back to my YouTube channel and today we are going to talk about pulp necrosis. So let's start our topic with introduction. Pulp necrosis is the death of dental pulp tissue that results from prolonged inflammation, trauma or loss of blood supply. It represents the end stage of pulpal disease, often following irreversible pulpitis or severe injury. Pulp necrosis can be asymptomatic or associated with pain and may lead to periapical pathologies if left untreated. Early diagnosis is essential to prevent complication and to plan proper endodontic therapy. Definition of pulp necrosis. Pulp necrosis is defined as complete death of the pulp tissue, including nerves, blood vessels, and connective tissue, resulting in loss of vitality and functions of tooth. Etiology of pulp necrosis. Pulp necrosis occurs due to factors that compromise pulp vitality. Common causes include untreated irreversible pulpitis, that is severe or prolonged inflammation that leads to ischemia and tissue death. Second cause is dental trauma that may include luxation, avulsion, or fracture injuries that disrupt pulpal blood supply. Third cause is deep caries lesions that are chronic bacterial invasion and toxin that expose gradually and destroy dental pulp tissue. Fourth cause is iatrogenic factors as excessive tooth preparation, thermal injury or chemical irritants can cause pulp necrosis. Fourth cause Fifth cause is periodontal disease, that is, advanced periodontitis may compromise pulp through apical or lateral canals. Sixth cause is systemic factors, as poor vascular supply due to systemic diseases like diabetes can predispose to pulp necrosis. Pathophysiology of pulp necrosis. It starts as initial inflammation that causes increased intrapulpal pressure. This persistent irritation leads to ischemia, cellular degeneration, and necrosis. Necrosis may be partial or total. In partial necrosis, there is necrosis of some pulp tissue, remaining pulp may be vital. In total necrosis, there is complete necrosis of the entire pulp. Necrotic tissue may become colonized by bacteria, potentially leading to periapical abscesses or chronic periapical periodontitis. Clinical features of pulp necrosis. First is pain characteristics. It is often asymptomatic and especially in slow developing necrosis. It may experience intermittent discomfort if secondary infection occurs. In this case, pain may arise if periapical tissues are involved. Second feature is tooth appearance that may include discoloration, that is grayish or darkened tooth due to loss of pulp vitality. Fracture or heavily restored teeth are more susceptible. Swelling or sinus tract may be present in chronic infections. Third feature is response to pulp test. In thermal test, there is no response to hot or cold stimuli by necrotic pulp. In electrical pulp test, there is also no response that indicate loss of vitality or pulp necrosis. In percussion test, it may show tenderness if periapical inflammation is present. Radiographic features of pulp necrosis. Early necrosis in this radiograph may appear normal. In advanced necrosis, there is widened periodontal ligament space, periapical relucency indicating chronic apical periodontitis, and internal resorption is sometimes be seen. Histological features of pulp necrosis. There is complete loss of cellular and vascular structures in the pulp in case of necrosis. Necrotic tissue may be dry, that is mummified tissue, or liquefied depending on the bacterial invasion. Inflammatory cells may be present at apical region if periapical inflammation occurs. An arundroblast layer is destroyed in case of pulp necrosis. Types of pulp necrosis. First is partial necrosis, that in which only a portion of pulp is necrotic and remaining tissue may retain vitality. Second type is total necrosis. In this, entire pulp is non-vital. It often follows prolonged irreversible pulpitis or severe trauma. Third type is wet necrosis. In this, necrotic pulp is liquefied due to bacterial action. Fourth type of necrosis is dry necrosis. In this, tissue is mummified and it is often seen in cases with minimal bacterial invasion. Differential diagnosis of pulp necrosis. First may be irreversible pulpitis. In this, pain is lingering and spontaneous, but pulp is still vital. Second is chronic apical periodontitis that may develop secondary to pulp necrosis. And third is periapical abscess, that is acute pain, swelling, and pus formation. Management of pulp necrosis. First we do is endodontic treatment, in which we do root canal therapy, that is standard treatment to remove necrotic tissue and disinfect canals. It is essential to prevent periapical infection and to preserve tooth function. Second, management include extraction, that is indicated if tooth is non-restorable or has extensive structural damage. Third is pain and infection control, as analgesic and antibiotics may be used temporarily if acute symptoms are present. Prognosis of pulp necrosis. It is good with timely RCT if tooth is restorable. The prognosis is guarded if periapical infection is severe or if structural integrity of tooth is compromised. An untreated necrotic pulp can lead to abscess formation, cellulitis, or systemic infection. Clinical significance of pulp necrosis. Pulp necrosis marks the end stage of pulpal disease. Early detection allows effective endodontic intervention. Vital pulp tests, radiographs, and clinical signs guide treatment planning in case of pulp necrosis. It prevents serious complications like periapical abscess or osteomyelitis, that is prevented by early treatment. Conclusion of this lecture video. Pulp necrosis is complete death of pulp tissue, usually following prolonged inflammation, trauma, or bacterial invasion. Clinically, it may be asymptomatic or associated with discoloration and periapical pathology. Accurate diagnosis using pulse sensibility tests, radiographs, and clinical evaluation is essential. Management primarily involves root canal therapy or extraction depending on the tooth condition. Early intervention preserves function and prevents complications. And this was all about pulp necrosis. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.